Having learned about the types, causes, and symptoms of stroke, it is now time to look at how strokes are diagnosed. Strokes are usually diagnosed by using a combination of physical, imaging, and lab tests. These tests can confirm the diagnosis and determine the cause and type of stroke. It is only possible to confirm the type of stroke using brain scans in a hospital environment, and for the best outcome, a person should receive treatment within 3 hours of their symptoms first appearing. The first thing your doctor will likely do is a physical examination. They will check for muscle strength, reflexes, sensation, vision, and coordination. They may also check blood pressure, listen to the carotid arteries in the neck, and examine the blood vessels at the back of the eyes. A doctor may also perform a blood test to check how fast your blood clots, your cholesterol and blood sugar levels, and whether you have an infection. However, even if the physical symptoms of a stroke are obvious, imaging tests should be done to determine which part of the brain has been affected and the type and severity of the stroke. The first type of imaging test that can be done is a computerized tomography scan, or more commonly known as a CT scan. This type of brain scan uses a series of X-rays to create a detailed 3D image of your brain. The image can usually determine whether you have had an ischemic or hemorrhagic stroke, tumors, and any other conditions within the brain. Doctors may also perform a test called computerized tomography angiography, which involves injecting a dye into one of the veins in your arm to improve the clarity of the CT image, allowing them to view the blood vessels in your neck and brain in greater detail. In the image to the right, we see how ischemic and hemorrhagic stroke appear on a CT scan. On the left is ischemic stroke, and this dark part here is the swelling in the brain that was caused by it. On the right is the brain after a hemorrhagic stroke. On a CT scan, the blood that is leaked appears white, making it really easy to determine that it is in fact a hemorrhagic stroke. Another imaging test that could be used is magnetic resonance imaging, or MRI for short. The MRI scanner uses radio waves and magnets to create a detailed view of your brain. It can detect brain tissue damaged by an ischemic stroke and any brain hemorrhages. In the MRI scan below, we see this faint white line on the right side, which is a bulging artery, signifying that there is a blood clot. As a result, an ischemic stroke was caused, and this discolored area shows the damage done to the brain tissue. The next two tests both involve the use of sound waves to look at the inside of the body. The first test is called a carotid ultrasound. In this test, sound waves are used to create detailed images of the inside of the carotid arteries in your neck. This can help determine if there is any narrowing or plaque within your arteries that is inhibiting blood flow to the brain. The other test is called an echocardiogram, which creates a detailed image of the heart using sound waves. It can be used to find any sources of clots that could have traveled from your heart to the brain and caused a stroke. As you can see, there are multiple tests and scans that are available for stroke patients. All of these procedures are extremely useful for diagnosing and tracking the progression of a stroke. After determining the type and severity of the stroke, a physician can start developing a specific treatment plan to help the patient based on their needs.